Let's explore the stages of labor. Definition of labor. Labor is a series of continuous progressive contraction of the uterus that help the cervix dilate and efface. This let the fetus move through the birth canal. Labor usually starts 2 weeks before or after the estimation date of delivery. There are 4 stages of labor. Stage 1, dilation and effacement of cervix. Effacement means the cervix stretch and get thinner, and the dilation means the cervix opening. As the labor near, the cervix stretch to thin and the dilate. This prepares the cervix for the baby to pass through the birth canal. First stage has 3 phases: latent phase, active phase and transitional phase. In latent phase, the cervix dilate up to 3 to 5 cm and contraction start after every 5 to 20 minutes. Contraction remain for 20 to 40 seconds and the patient is sociable. In active phase, cervix dilate up to 4 to 6 cm and contraction comes after every 2 to 5 minutes. Contraction remain for 30 to 50 seconds. In transitional phase, cervix dilate up to 8 to 10 cm and the contraction are usually very strong and lasting up to 60 to 90 seconds and occur every few minutes. In second stage of labor, there is delivery of fetus. It is very painful phase. Painful phase for primipara is up to 1 to 4 hours and for multipara it is up to 20 to 40 minutes. Role of nurse in second stage of labor. Nurse has to tell the mother for voluntary pushing along with the contraction. If mother feels sleepy by exhaust from the voluntary pushing, then she can sleep for a few minutes. But then she has to push when contraction will come after few minutes. Nurse has to put his one hand on the patient abdomen and help in pushing when she feels the contractions. Stage 3, delivery of placenta. Do not apply traction to the cord until placenta separates from the uterus. If cord stretch before the separation of placenta, then it will cause hemorrhage and uterine prolapse. Placenta separation are of two types: central separation method and marginal separation method. In central separation method, it occurs at the center of placenta due to formation of retroplacental hematoma, and this part descends first and little blood flow in central separation method. As you can see from the diagram, the first diagram is central separation method and another one is marginal separation method. In marginal separation method, placenta separation began at the lower edges of the placenta and the placenta slip down from the sideways and there is a heavy blood flow. When placenta is going to be separate from the uterus, then make sure whole placenta should be separate. If any part of the placenta remain in the uterus, then it will cause postpartum hemorrhage. It may increase the risk of infection. And make sure do not pull the cord until placenta will fully separate because it will cause uterine inversion, hemorrhage and uterine prolapse. If placenta remain in the uterus, then HCG doesn't decrease and it will cause postpartum hemorrhage. And postpartum hemorrhage occur due to restriction in contraction due to presence of any part of placenta in the uterus. To prevent from further tears and injuries, doctor will proceed episiotomy. After delivery, uterus immediately lie between the midline of the umbilicus and the symphysis pubis. After 24 hours of delivery, uterus lie on the umbilicus and after that, uterus go down 1 cm every day after delivery. Uterus should be firm after delivery. If it's not, then it will increase the risk of hemorrhage. If uterus is soft, then we gently massage to make it firm by putting one hand on the symphysis pubis and with the use of another hand massage the uterus in a circular motion. It will help in contraction of the uterus. If it's not, then notify the doctor. If massage should be done without using another hand, it will cause uterine inversion. Stage 4 Recovery Phase. It is about 1 to 4 hours. After delivery, mother may feel fatigue and she can say that she is unable to feed right now to her baby. Then it's the role of the nurse to feed it. It doesn't affect on the bonding between mother and the child. After delivery, sometimes mother may feel chills, so nurse should give her a blanket. Check the amniotic fluid when there is a water breakdown. Then nurse have to assess it. If amniotic fluid should be clear, it may indicate bit of vernix. Vernix is a creamy fetal skin lubricant. If amniotic fluid is golden or yellow, it indicates RH incompatibility. Or if it is cloudy or foul smelling, then it indicates infection. Green color indicate meconium pass and port wine color indicate abruption. And if there is a hypertonic contraction, it will reduce the placental blood flow, which is occurring less than 2 minutes and the duration longer than 90 to 20 seconds and interval shorter than 30 seconds and incomplete relaxation of uterus between the contraction and increase the resting tone not more than 20 mm of Hg. In that case, squatting position is best for delivery.